And a good Saturday morning to you. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic in Rockford, Illinois. And we've talked about arthritis before. I know there are different types of arthritis, and today's topic is osteoarthritis.
Yes, sir. There are different types of arthritis. There's the rheumatoid arthritis, and that is the more severe crippling form of arthritis. And then there's old age arthritis that we're going to talk about today, which is osteoarthritis or degenerative joint disease. It goes by different names. There's traumatic arthritis, that's someone injured themselves at one time and it deformed a joint. There's infectious arthritis. You can have tuberculosis or any other type of infection in the joint itself that causes swelling. That would be arthritis. But for our purposes today, we're going to talk about osteoarthritis.
All right. And arthritis defined means what?
Well, osteo means bone, and arthritis means inflammation of the joints. So this would be an inflammation of the joints between the bones. Be the best way to put that.
And that's the most common
That's
kind.
the most common. The other forms of arthritis almost always end up forming osteoarthritis. If you have one form, it'll frequently turn into that eventually. It's also called old age arthritis. You know, when people say, well, you got that arthritis, it's because you're getting old. Well, that's osteoarthritis. And so people will get it, and they'll frequently get it, Fred, in the joints that wear out, the joints that are used the most. You know, so if you have a certain job that you do all the time, you're maintaining a certain posture all the time, those joints there may be the ones that go first, and so you'll end up having trouble in those areas.
I'm sure you want to treat the inflammation then so that it doesn't produce something that is, cannot be reversed later on.
Yes, you do. And we always try to find out what's causing the arthritis. And frequently, Fred, someone will come into our office and let's say their neck bothers them. And we take x-rays and we look at their neck, and there's a couple things that we find that would indicate arthritis. Number one, there might be bone spurs. Bone spurs are indicative of arthritis. And so it's a joint that's not very stable, and the body puts calcium into the soft tissues to try to stabilize that joint, and you get the spur, which is basically calcium infiltrating there, and not necessarily too much calcium or not enough calcium. Frequently it is, but it's because it's an unstable joint. Another thing that we find will be disc degeneration, or the cushion in between those bones will be diminished or degenerated, we could say. And so those are two things that we find. There can be sclerosing of the joint, swelling of the joint capsule and stuff. Those are things that we find on x-ray that we can see that. And then from that point, we try to see why that person has that in their spine, and then what can we do to try to alleviate it?
You know, it's interesting. I've read that in some cases where, the calcium is there, the calcification, it's there actually, as you said, to stabilize, but it in some cases isn't because of too much calcium, but a lack of calcium, and the body draws calcium from other places in your body to heal that spot.
That's good. That's very good. That's very true, Fred. A lot of times, even today, there are doctors that tell patients, "Oh, you got bone spurs. Don't take any calcium." It's not because of calcium. It's usually too little calcium, and your body does take it out of the bones and put it into the soft tissue. So it's not a question of too much calcium. It's a question of an unstable joint that the body is just naturally trying to stabilize. The problem is when it does it, it doesn't move anymore, and the end stage is a complete fusion, where those bones will never move again. So when people start losing ranges of motion in their joints, whether it's in their neck, which we frequently see, but any other joint, the bones just don't move like they used to, there's an indication that it could be degenerative joint disease or osteoarthritis, and that's something that chiropractic can help more than anything else.
First, you have to diagnose it, right?
Yes.
How do you do that?
With x-ray.
Okay.
To see is to know, not to see is to guess. And we don't want to guess with anybody's health.
And
that's
of course,
a little saying that we have in our office.
That's a great saying.
And we want to see the problem. And if you don't take an x-ray, you don't know what's going on there. And so, yes, we take an x-ray and then see that it's arthritis. And then we'll do a couple things, Fred. Number one, we try to make sure that joint starts moving correctly. So we'll start chiropractic adjustments. And usually And I guess I could say every single time you have an arthritic joint, that joint should have chiropractic treatment, because that's the only thing that'll realign that joint and start the process of getting more mobility in there, because you're stretching that joint and realigning it. The second thing that you want to do is put that person on an exercise program. Now, exercise is not the first thing you want to do. It's the second thing you want to do, because the exercise in itself does not prevent arthritis. In other words, if there's a joint that's not working properly and you exercise that joint could get worse, could wear out more.
You want to get the joint aligned first.
Yeah, you want to get that joint aligned and working properly. Then you want to exercise it through its normal ranges of motion, and that would be a key thing that you'd want to do. So that'd be the second thing. The third thing, Fred, would be maybe different types of physical therapy. We do different types of traction, mostly traction, because we want to get more mobility into that joint, and also put that joint into a proper position with different types of curves that are in the back. So we'll do different types of therapy. We might do acupuncture as a form of therapy also, which is a natural pain reliever, and it restores function to the joints too. Usually you put in acupuncture needles. When you take them out, 15 minutes later, that person can move the joint normally. It's amazing what acupuncture will do. So we'll treat it with physical therapy with acupuncture. We might recommend certain nutritional supplements, and glucosamine sulfate is a big one that we recommend, and we recommend it with MSM, which is another supplement that when you put the two together, we get phenomenal results with it. Now, the reason why you'd use those two supplements is the glucosamine sulfate. What that does, it basically helps your body repair itself better. In other words, there's a normal tearing down that takes place of the joints. Everybody has it. And then there's a normal building up process that everybody has. So, you might tear your joint down during the day, and when you sleep, it builds up, and the next day you're fine. Well, as you get older, the rebuilding process slows down, but the tearing down process stays the same. And so by taking the glucosamine, it helps the rebuilding process. And so your body, after a couple months of taking it, is starting to rebuild better. Now, the MSM is a supplement that is anti-inflammatory, and you get quicker results. So that with the glucosamine, it's going to take a couple months before you get the results. But the MSM, usually within a week or two, patients start saying they're feeling better, and you combine the two, and it's very good nutrition for the joints.
And there are some other types of natural anti-inflammatories. I'm thinking of grape seed extract and other things like that.
Yes, those are good. Anti-inflammatories in themselves, like drugs, if you're talking Tylenol or aspirin or something like that, people normally take those, but what they found is it does reduce the inflammation.
It hurts your kidneys, though.
It hurts the kidneys, hurts the liver, but also a lot of times you don't feel that the joint is not aligned properly, and so the joint gets worse and worse while you're taking it. You're not feeling it, but it's getting worse and increases the damage to the joint. So we tell people, if you're going to take an anti-inflammatory drug, do it just for a short term. If it's really bad, take it now while we're trying to treat the cause, and then we'll get you off the anti-inflammatory in a week or two.
And, of course, we have our drug commercials on television, and they just never stop, and arthritis is one of the biggies. And I know it was just over a year ago, I think, that Celebrex got in trouble because it was found out to have some bad side effects.
Yeah, like death.
Yeah.
Yeah, we cured the arthritis, but the patient died. That's the problem. See, that's the problem with drugs, and so that's why we try to get people well without drugs, and arthritis should be treated without drugs. Now, there may be crippling forms, sometimes rheumatoid arthritis. Yes, you do need some type of steroid drug to get it under control.
How would you differentiate between a drug and a natural remedy or a supplement? What is the difference?
Good question. The difference is a lot of times, well, take aspirin, for instance. Aspirin is really comes from a willow bark. Now, the American Indians used to chew the bark, and it would help get rid of pain, fever, and such, just like aspirin does. but it was a natural substance. Not only was there aspirin in there, but there were other ingredients that are normally found with it that when you put everything together, it worked well. But when you take it in its pure form, just take that one drug and then manufacture it unnaturally or commercially, however you want to call it, then you're getting something without anything with it that's normally found in nature, and so then you get the side effects because it actually is missing certain ingredients when you take it.
And so normally you would see more of side effects from drugs, manufactured drugs, than from natural supplements.
Yes, and another thing, Fred, your body has natural cortisone, let's say, in its own body. And so your body manufactures cortisone. Now, a lot of times when people have joint pain, it could be, Fred, because their body is not manufacturing enough natural cortisone because of an adrenal gland problem. And so if the body's not making enough cortisone, that might be causing the arthritis too, to a certain extent. We do see that sometimes. And so then people will take cortisone orally, or they'll take injections of cortisone and such, which does help the pain, but then it's not natural, and then you can end up with all sorts of other side effects from cortisone.
And of course, the funny thing when you listen to some of these commercials, they're required by law to mention the side effects, and it's enough to scare anybody away from taking those drugs, I would think.
Sometimes the cure is worse than the disease.
I think so.
Or sometimes if you're taking a drug for stomach pain and then one of the side effects is stomach pain, you think that's, well, I thought that's what I'm taking the drug for. But anyway, we're not against all drugs. And like I said, with rheumatoid arthritis, some of these arthritis, you do need some type of drugs. If you got infectious arthritis, you need an antibiotic.
Sure.
You know, you don't need your chiropractor. But if you've got osteoarthritis, you need your chiropractor. And chiropractic treatment is the best form of treatment for osteoarthritis.
It certainly would, seems to me, behoove a person to check it out, and if they can be healed by natural means, that is definitely the best way.
Absolutely. And Fred, I get patients that, some patients come to me and they've had chiropractic treatment all their life. And some patients of mine have had chiropractic with me for 20 and 30 years. And when I take an x-ray of these patients, you're amazed. Their neck, they might be 70, 80 years old, and it looks like they're 30 or 40 because their spine is lined up. They get very little arthritis. But I can get somebody that comes in their late 20s or early 30s that maybe they've been in a car accident or an old football injury to their neck, and then you take an x-ray and they've got osteoarthritis. It looks like they got a 70 or 80-year-old neck.
I know that you have more information on osteoarthritis.
Yes, they should contact our web at www.warnerchiro.com, or they could call us at 815-398-8111.
warnerchiro.com or 398-8111. Interesting topic. I know a lot of people are interested in it.
Yes.
Thank you so much, Dr. Jim.
Have a great weekend.
And that'll do it today for Health Matters.